and with that we are back. Perhaps it was a light-hearted view of what the world is really going through from the eye of a caricaturist or an artist. Well, it is perhaps something that we can actually really much indulge in, because it is something absolutely encrusting. No matter how bad of a painter you are, if you just go ahead and do it, there is a certain positive energy which comes out of the beautiful colors that you have just imagined on a canvas or even a piece of paper, even if it is just scribbling a filthy looking cartoon or just about anything it may be. However, at the moment we're going to be moving on from this part on towards our second part, which is slightly a little bit more in depth. It has got nothing to do with the beauty of this world, but actually something to do with the problems that the world actually brings up with. We are going to be discussing cholesterol in this part of the program, in which we are going to be actually focusing on the reasons why there are so many people suffering from cholesterol, and what is the proper diet routine and lifestyle that a person with cholesterol should go on with. With us, we have Dr. Muhammad Al-Shaif, who is the consultant in internal medicine and coagulation at King Fahad Medical City. So, assalamu alaikum and good morning.
Good morning.
So, doctor, we all are well aware that cholesterol is a spreading disease. It has become very common, perhaps a little more common than even diabetes. So, what would you say that in Saudi Arabia is the right diet to follow in order to be avoiding cholesterol to begin with?
First of all, we have to know, what's the definition of hyperlipidemia? Increased lipid levels, because lipid is formed of cholesterol and triglycerides, and we have to measure not the absolute amount of cholesterol. However, we should divide the cholesterol into good and bad cholesterol. That's the most important, because we want the bad cholesterol to be as low as much we can, and the good cholesterol we want to be high, because good cholesterol protect against heart attack, as well as triglycerides. So right now it's called hyperlipidemia or dyslipidemia, because not always we care about high figure, also about low figure, because low good cholesterol is not good, should be high. And in Saudi Arabia, I think there are major epidemic of metabolic syndrome. Metabolic syndrome is formed by obesity, and most important is central obesity or truncal obesity, increased waist diameter, and also the high cholesterol, which is important, triglyceride, and low good cholesterol, as well as smoking, because these are three major threats, for our cardiovascular health. I think in Saudi Arabia, diabetes, abdominal obesity and dyslipidemia, smoking, all share the same prevalence, about, or same percentage, 25%. Like every 4 people, they have one of these major risk factor for cardiovascular health.
Indeed. I really like the fact, Dr. Muhammad, that you mentioned not just obesity but abdominal obesity, because here in Saudi Arabia, out of 10 we would see like 4 people or 5 people more, even, who are not obese all the way from top to bottom, but they have just one area where they have excessive fat stored. Now, for a lot of people who like to study a lot of literature, health-wise or medical even, health awareness even, they get to come across very often this particular thing that says that if when you pinch around your waist, and if it's anything more than an inch, that means that you need to take it seriously. And I believe there's a set waistline for females and for men. Yes. I completely forgot the figures. If you would remember it, to mention it to our viewers as well, that how important it is for us to even see, the deposits of fat in our body, because a lot of times we may feel very healthy, we feel perfect, until, God forbid, something happens, things go out of control. So eventually, because everybody loves to look at themselves in the mirror, whether they find themselves good looking or not so good looking, the people who really have a high self-esteem, who love themselves, who think they're very good looking or very beautiful, and even our men, every now and then we see them stopping and looking at their reflections, some admiring it, and then fixing their shemagh and eventually moving on. So what are the things that they have to look for themselves in their physical aesthetics to know that they may actually have a problem from the roots of their body, which is just budding up?
Actually, previously, the emphasis or focus on the body mass index, which is a ratio of weight per kg over height meter square. And the desired ratio from 18 to 25, and over 25 to 30 it's overweight, and more than 30 this is obesity, and more than 30, and some say more than 30 is morbid obesity. But nowadays the attention or the focus shifted to the abdominal waist circumference, and also hip waist circumference. The abdominal waist circumference, it depends on the gender, male or female, and ethnicity. Whether you are, Caucasian, you are Middle East, Arab, or you are Asian. And the desired, abdominal waist circumference for male should be less than 40, and for females less than, 35. And this is according to the American Heart Association guidelines. However, there are some, American Diabetes Foundation, they want more reduction. They are saying less than 37 for male and less than 33 for females. The bottom line here, the abdominal obesity is really quite common. Like you see somebody whose body mass index is good in the desired range, like 25, or however he has abdominal obesity. Okay, this is why we are focused on abdominal obesity, because it has, future, association, increased future risk of diabetes, increased future of fat accumulation over the liver, and hypertension, and coronary heart disease, or heart disease. Nowadays, always I'm training my trainees, always measure abdominal circumference, waist circumference, the ratio also, it's important. And how we, because controlling weight alone will decrease lipid, weight control or weight reduction, and diet will decrease cholesterol or high cholesterol by 20-25% only. Okay, so it has to be supplemented with medication and other stopping other bad habits like smoking and physical inactivity. And I think right now we have to be very specific with our patient to say exercise, not only just exercise. You have to specify walking like for 30 to 60 minutes 7 times per week. It's like prescription. So walk like this, and the waist, tell him this is the waist, the desired waist. So every time, not like just to say patient decrease your weight and without giving specific goals. Always dietitian, we work with dietitian hand to hand.
Right. And exercising means that, let's say if you're having a walk, it's not a walk, but eventually leading to a brisk walk at least, so that your heart rate gets high, so that the blood could actually flow all around your body to the point that you actually feel that, like you're getting hot, you're feeling hot, not because it's 40 degrees outside, but because you're internally feeling hot because you have been working out. All those calories is like something which is really essential and very important for all of us.
Most definitely. And other than that, perhaps going on with some kind of sports activities is really going to be helping, because recent studies have actually proven that athletes have lesser health problems and they have lesser fat in their bodies and more muscle mass, which is definitely good for all of us. But of course, since we are not athletes, we can at least try and enjoy ourselves and commit ourselves to these activities, so we can actually have like a daily plan of some kind of a walk. However, what I do want to ask you, sir, is in Saudi Arabia, limiting to the rest of the world, who are more likely to be ending up with cholesterol, the males or the females?
Okay.
And what is the age group for those people who should be aware at the fact that they might as well get cholesterol?
Yes, regarding, you are bringing us to an important issue, which is screening for high cholesterol. So every male, healthy male without other risk factor should start screening more than 35 years of age, okay, or someday 40. And if a female 40 to 45 years of age. So this is healthy. But if you have other risk factor, like if you are a smoker, hypertension, diabetes, you have also what we call coronary heart disease, equivalent. Like if you have, a poor circulation to the extremities, if you have stroke, if you have mini stroke, these people should be screened earlier. So regarding back to the gender, it is more common in males than female. Also the heart attack or cardiovascular disease more in males than female. It it could be due to, you know, protective effect of, estrogen. It is just postulated, but not for sure. So I'm urging all people, you know, to go to screen their lipid profile if they are falling in this category. However, if you have family history of high cholesterol, it should be screened earlier, even at age 20. I think the percentage here is under-recognized because people are not screening, you know, themselves till they have the heart attack, they have stroke, they have, you know, the end point, you know, of hypercholesteremia. Remember, high cholesterol or hypercholesteremia or hyperlipidemia is asymptomatic. So you don't have any symptoms till you have the heart attack, you have, the peripheral, you know, poor circulation to the lower extremity or stroke. Sometimes, you know, you might have in the skin some, you know, deposit, like in the eyelid or over the tendons, you have some deposit. It's yellowish discoloration under the skin. This is indicating you have high cholesterol, but most of the time it is asymptomatic. So I'm urging people to screen before they, have. Then it will be not primary prevention, it will be secondary prevention because already the disease occurred, and right now we want to prevent another attack.
Indeed. Now, Dr. Muhammad, from the clinical trials and the medical literature, and with your own clinical experience here in Saudi Arabia, how do you feel about family history? How significant is family history, especially when it comes to cardiovascular complications? That means, you know, leading from high cholesterol levels especially. I mean, what is the percentage of the family history over the people who have no relevant history in the family at all? And family history, what is it that we are calling family history? Does it mean my uncles, my father?
Definitely, important question. This is a very important question. The first degree relatives, like siblings, brothers, sisters, and parents. This is, we call it first degree relatives. If you have anyone, male, you know, first degree relative, more than less than 55, or female, you know, first degree relative, less than 65, with coronary heart disease or heart attack, so you are, you have strong family history.
So let's take a moment here. We mean when we say men above 55, because
yes.
Above 55 we say that, okay,
this is the typical age.
It's normal for human body to have something. But if somebody has an onset of, let's say, diabetes, high blood pressure, high cholesterol, cardiac complications before, like, you know, expected age, as we may call it for now, so that means that they are at high risk.
Yes.
Okay.
Yes, and what's the proportion of family history as contributing to, hyperlipidemia? We don't have, you know, accurate, you know, statistics regarding this. But most of our patients, from my clinical practice, my clinic, significant portion, let's say more than 25% of them, they have, you know, family history of high cholesterol. I think maybe the awareness, we need to, you know, disseminate awareness regarding this topic. In the Western countries, the family physician taking this role, they are screening all people, you know, for hypercholesteremia, you know. Here we don't have effective screening program. Remember about a few years back that we screened for diabetes, hypertension, and we discovered so many people, they are in the very important concept we call pre-diabetes or pre-hypertension. This is like people, they have borderline hypercholesteremia. It's not the abnormal range, it's not the normal, you are just sitting in the fence. These people should be targeted because this is the most effective intervention regarding, you know, dietary, you know, modification, which we call effective therapeutic lifestyle modification by diet, by reducing weight, and by quitting smoking and alcohol. And very important here that the diet here is consumed is, I think, maybe the worst diet in the world, because we are consuming a lot of fries, okay? You know, somebody will argue, oh, the East, you know, the East Asia, you know, they also consume rice, but they are little amount. Here we are consuming rice with a lot of saturated, you know, fats like red meat. And that's why we notice more abdominal or more central
obesity. And that too,
obesity.
We are taking refined carbohydrates.
Yes, refined carbohydrate. I think the best diet studied, you know, in the world we call Mediterranean diet. What's Mediterranean diet? It contains, you know, high fruits, vegetables, high fiber diet from beans, nuts, okay, and high, white meat, which is the chicken, okay, poultry, and less red meat, and also the cereals, and consuming a lot of fish. Fish, okay, so fish contains, what we call omega-3 fatty acid, which decrease the triglycerides, okay, which is other part of lipids. So this is like, it was, established as the best diet in the world. Here it's, we are consuming the Middle East diet with, some American, the junk food, and I think we have to be careful about our diet.
Indeed, true.
Yes.
Most definitely. Moving on, sir, there are often allegations that it is not only the food which is causing up cholesterol, but then there are like family gimmicks that it is because of stress, it's because of the lack of sleep, it's unrest, and everything that acts upon it because the body is not getting the natural habitat to actually process and all of that. So how would you say a Saudi man who has some history of cholesterol or diabetes or any kind of these diseases which are very common to our ears now, how can we avoid it as a youngster? Because, well, I'm just 19. I do not have any family history, but what are the precautions that I should be taking before anything literally hits me? Because at a younger age, prevention is a little easier because you can make a lifestyle out of it. So what would you say, what kind of exercise would you recommend our viewers at the moment who are watching you? Something which is going to be a little less related to the gym, because we all hate going to the gym. So what is it as a doctor that you would advise us to take up as an exercise to really avoid any kinds of ailments to come to us?
I think it depends on your time. If you have time, I recommend you to go to gym, okay, to regular, exercise activity. But if you don't have time, you have alternatives like walking, brisk walking, like 30 to 60 minutes, preferably most days of the week. This is very effective in reducing your weight, reducing your bad cholesterol, and raising your good cholesterol, and also reducing the triglycerides. And here I came across, during my training in Canada, we use it for our patients, because some patients during their work, they walk a lot, they ride upstairs, downstairs. So when we ask them, do you exercise? They say, oh, I don't need to exercise because I'm, most of my day, walking. So we ask them to use, this is pedometer, step counter. So this step counter, you just put it in your, seat belt, in your belt, okay, and you will measure how many steps, okay, and how many calories you burn. And it is preferable that you have 5,000 steps per day, okay? This is too much, but this is the 5 to 10,000. So the least 5,000. I will say achieve,
2,000.
2,000 will be, this is good. I use it myself personally. This is a pedometer or step counter. You can find it in some, pharmacies. It's excellent and will gauge you. Oh, so today I burned, 1,000 calories. Oh, this is the goal, okay? So this will keep you on track. And again, very important point, because I have misperception for patients. They said, oh, we are not eating junk food. We are taking care about our diet. In spite of that, they have high cholesterol. So this is genetics play a role, because cholesterol is 75 to 80% formed in the liver, in our body, internally, and only 20% externally from the diet, okay? So sometimes people, so they are careful about their diet, okay, exercise, but however they have high cholesterol, okay? So we tell them this is because we have to use medications, to decrease the cholesterol synthesis or formation, which is the most common, because I'm sure patients watching this, they are aware about statins. Statins, they are the most commonly used medication around the world. I'm sure it is. There are many, members of this group like Zucor, simvastatin, atorvastatin, which is the Lipitor, and Cristor, which is atorvastatin. So these medications, very effective, most effective medication, and they reduce the bad cholesterol and increase good cholesterol.
Indeed. And with this, Dr. Muhammad Abdullah Shaikh, we'd like to thank you so much for joining us in today's edition of the program. Some of the important things that we would walk away from this discussion with means that everybody has to exercise. Whether you are 19 or 90, you all need to exercise at least 2,000 steps per day, so a pedometer, or as Dr. Muhammad has been mentioning, it's really important for you to know how many steps it is that you are taking every day. It's not only about controlling your diet, but it's also portion control as well. Even if you're going to be eating healthy food and you're eating excessive amounts of food, is not really good. If you have any kind of a significant family history in your family with a first-degree relative at the age of 55 or a female at the age of 65, having any kind of coronary artery diseases, any kind of cardiac complications, you need to be very, very careful as well. And for our government as well to take more of the concrete measures towards making our youth healthy, because if we would think about our society, we have more than 50% here in the Kingdom of Saudi Arabia comprising of young people. So if these young people eventually are going to become obese, eventually if they would develop cholesterol complications, high sugar levels, or hypertension complications, then it is going to be a hefty toll it is going to take on our economy at large to treat all these people who have cardiac complications, who have developed diabetes mellitus or so and so. So if we would start prevention eventually from early age, if you would start educating our school-age children who are actually going to school, it's going to be the first day of school for so many of the Saudi children out there as well. If we could educate them more about proper kind of a lifestyle management and proper diets, it would all help us a lot in the long run eventually. But with this, eventually, we would like to move on towards another discussion in Good Morning KSA, as we usually divide the program in different segments. We're going to be moving on towards Time to Focus, but for the moment, again, special thanks to Dr. Muhammad Abdullah Shaikh for joining us in today's edition of the program. You really made the whole segment very informative for our viewers out there, and we hope to see you again in our program.
Thank you very much. Okay.
Well, this is a wrap from high cholesterol levels, and we'll give you and your hearts and your minds a break. We're going to go towards Time to Focus, after which we would resume today's edition of Good Morning KSA.
The men who stormed